The Declawing of Cats by Amanda, Brooke, and Danny. We have chosen the animal welfare issue of declawing. Declawing is also called an onychectomy, which is a partial digital amputation. This means the surgical removal of the third phalanx and the nail of the toe. This is an elective procedure that is meant to mainly prevent the cat from being able to scratch and damage property. The procedure. There are 3 different methods used to perform this operation. These methods include using a scalpel, a laser, or nail clippers. Using a scalpel or a laser is called the excisional method. This method removes the third phalanx, which is the last bone of the toe. The guillotine method uses nail clippers. This method severs the third phalanx in half and removes the nail as well as half of the third phalanx. There is another method, but it does not remove the nail. Instead, the tendon that operates the nail is cut. Cats who have this operation must always have their nails trimmed. This operation is called a tenotomy. Any of these methods are best done when the cat is between 4 to 8 months old and is at ideal weight. This way, the cat will experience less pain and may have a faster recovery. However, there are possible complications that can occur with any of these methods, and they include bleeding, nail bed infections, pain, nail regrowth, especially with the guillotine method, pad injury during the surgery, burns, limping short-term or long-term, changes of personality, increased biting, and other common surgery risks. So why is this an issue? Declawing is seen as a welfare concern when it is done as an elective surgery, which means it has no medical benefit for the animal. This procedure can be quite painful and can lead to multiple complications, including short and long-term effects. There are numerous alternatives for this procedure, so we raise the question, is it ethical to declaw cats? Arguments for protection for people. Cat scratches are painful. They can transmit cat scratch disease, which can lead to infections, and it can even be life-threatening in some cases. Cat scratch disease is also referred to as CSD. Cat scratch disease is caused by the bacteria Bartonella henselae, which is cultivated and spread by cats through cat fleas. Bacteria in the wound can lead to an infection, causing the person to need antibiotics. But if the person has immune-compromising conditions such as AIDS, diabetes, hepatitis, cancer, or even just old age, then it may be life-threatening for them. There was a study done about cat scratch disease to see how many people were actually diagnosed with the disease from the years between 2005 and 2013. The report statistics stated that in those 8 years, nearly 13,000 outpatients were treated for cat scratch disease, and almost 600 inpatients needed to be hospitalized. Therefore, an argument in favor for this procedure is that by declawing cats, it could be providing protection for people from infections, pain, and other health issues. Protection of homes. Inside cats still have a natural instinct to scratch, but if they are not provided with a scratching post or a similar object, then they may result to scratching furniture, carpets, rugs, people, and even other pets. Declawing allows for the pet owner to protect these things from any damage. This also serves as a solution for the pet owners so that they do not have to rehome, abandon, release, or euthanize their cat. Arguments against: quality of life. Cats use their claws as a defense mechanism to protect themselves. Their anatomy is permanently changed after being declawed and can result in long-term side effects, such as how they walk. The procedure changes the way a cat's foot meets the ground and can cause them pain. Declawed cats won't have as good of balance, so they will have to relearn how to walk properly. They may also experience tissue necrosis, paw pain, lameness, and other medical issues. Declawed cats may also have increased risks of unwanted behaviors, such as inappropriate urination, biting, and aggression. Non-therapeutic. Non-therapeutic means not to provide therapy. In other words, it means the procedure provides no medical benefit. Declawed cats may experience acute and chronic pain as well as other common surgical complications, such as hemorrhage, abscess formation due to claw regrowth, dehiscence, susceptibility to disease, paralysis, or distal limb ischemia due to bandaging. Putting healthy animals through this because of a non-therapeutic procedure invades the 5 freedoms of animal health welfare, including freedom from pain, injury, and disease, by inflicting unnecessary acute and chronic pain on the patient, injury due to complication, and susceptibility to disease. The freedom to express normal behavior, by removing the cat's ability to protect themselves and exhibit normal cat-like behavior, as stated earlier. And freedom from fear and distress, by inflicting mental suffrage on a patient during hospitalization, follow-ups, and recovery. Our position. We are against the declawing of cats. It is not simply a question of advantages versus disadvantages, but ethicality. There are pros and cons, but we believe that the pros should not invade any of the cat's 5 freedoms. So if the procedure is not done for a therapeutic purpose, it should not be done, as it provides no medical benefit for the animal. Action plan. Some measures have already been taken, such as declawing already being banned in some regions, such as the United Kingdom, Europe, Australia, New Zealand, Brazil, Israel, and some areas in California. In Canada, it has recently been banned in Nova Scotia and British Columbia. Some associations and organizations release their own position statements on animal welfare topics. The Canadian Veterinary Medical Association, for example, has released a position statement on declawing. They see it as unacceptable as it offers no advantage to the feline. The American Veterinary Medical Association describes declawing as not a medically necessary procedure for the cat in most cases. It is important that pet owners are educated about the procedure and the side effects it may have. Pet owners should then consider if declawing is the best solution for them or if they could use a less invasive alternative. How you can get involved. There are many organizations who publicly advocate against declawing, and there are ways that you can help to support them, such as donating, offering to volunteer, sign or even start petitions in a peaceful manner, support and advocate for organizations to help spread the word, or talking to your government directly about the issue. The PAW Project is a nonprofit organization that tries to educate the public about the negative effects of declawing. They offer many ways for you to get involved, by helping them spread support to stop declawing through social media, bumper stickers, or posters, or you can join and promote their different projects and petitions. What pet owners should know. Cats use their claws for balance, protection, to climb, to stretch, and to mark their territory. Declawing them means they no longer have these abilities, and it will also change their anatomy. They will be forced to put weight on their second phalanx rather than their third. This will make them feel uncomfortable and make them feel pain. Pet owners may see behavioral changes like urinating inappropriately and outside of the litter box, more vocal, more aggressive tendencies, and increase in biting. Pet owners should also know about possible alternatives that are available. These include trimming their nails often to decrease damage from them scratching, provide things for them to scratch, such as scratching boards, pads, posts, and cat trees, the use of nail caps, and place special double-sided tape on furniture or other items that the cat frequently scratches. This will deter the cat away from scratching there. Conclusion. Cat owners usually decide to declaw their cats to prevent negative scratching behavior, but scratching is a natural behavior for cats, which is why we do not support the declawing of cats. After examining arguments for and against the topic, we can see that the pros are not ethical and are invading the 5 freedoms. Other alternatives should be used to limit negative scratching behavior, and declawing should be reserved only for cases in which it serves as a medical treatment for the animal. To help, the public needs to join together to show more support against declawing to help ban it in all regions, other than as medical treatments. The more people that advocate to stop this welfare issue, the more likely it will get banned. Thank you for listening and watching our presentation.